Have you been diagnosed with a disc herniation? Do you have neck pain with radiating pain going down your arm, maybe numbness, burning, and tingling? Or do you have back pain with pain radiating down your leg or numbness or tingling? Have you wondered, can chiropractic care help? Do I have to have surgery? Don't worry, you're not alone. I'll give you the answer very simply. Most disc herniations respond well to chiropractic management. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and I'm fellowship trained in primary spine care. In addition to my education, training, and experience, we've been managing patients with disc herniations in our clinic for decades. Please remember, these videos are not a substitute for medical or chiropractic advice, for diagnosis, or for treatment. Seeing the wrong doctor can result in the wrong diagnosis, the wrong treatment, and poor to no recovery. This is a very brief video overview on disc herniations. There's a lot of other videos on our YouTube channel going into some detail on different questions and different aspects about disc herniations, and I invite you to look at those if your questions aren't answered watching this one. So if you have a disc herniation and you call a chiropractic clinic, what can you expect? Well, I don't know, but I can tell you what we can expect at our clinic. The first thing that we do is we do not do treatment. The first thing that we do is we do an examination. We listen to your story. We listen to your symptoms. We see how it's impacting your life. We do a physical exam. We see how the disc herniation is impacting your body. And then we look at your MRI. So yes, you do need an MRI. If you haven't had one, when we see you, we will order an MRI for you. When we look at the three, your symptoms, your exam, and your MRI findings, we can then tell you what you can expect. That's called your prognosis. You see, even though I said that chiropractic care can help most disc herniations, the answer is a little bit more detailed than that. Disc herniations can be mild, they can be moderate, they can be severe. And there are simply some disc herniations that we can't help, and we'll tell you. There are disc herniations, though, that are very mild, but they can be very painful. Those we can help. Going through and doing the exam, we can have a good idea of the ones that we can help and the ones that we can't, and then we put together a treatment plan. Common treatments that we would use would be chiropractic adjusting. Sometimes we recommend and order traction, dry needling, acupuncture, therapy exercises, things of those nature. It all depends on the person's diagnosis, the severity of the diagnosis, and the person's overall condition. One of the other things that factors in is the disc herniation itself might not be the only thing that's painful. I have a model here. And this shows a disc. So these are the bones of the spine. And this right here is the disc. These little bumps that stick backwards, if you look at it from behind, so this would be the back of a human body, those are the bumps in the back of your neck. This right here is muscle. This right here is the disc between the two bones. When the disc herniates, the disc is alive. There are nerve endings inside the disc. The disc itself can be painful. When it herniates and the material herniates out, it can press on different structures. Common ones would be a nerve. That can be giving you additional problems. However, when the disc herniates, it can also affect the surrounding muscles, sometimes the joints. This right here is a joint on the back of the spine. This one is red and inflamed. This one over here is normal, healthy, and yellow. So there's all these different structures. So it might not be just the disc. The disc might be the main pain generator, but there might be some other tissues in and around that area. That is why an exam is so important before any treatment is ordered. And also the exam is important for coming up with realistic expectation in terms of recovery. I hope you found this video helpful. I hope you found it encouraging if you're struggling from a disc herniation. If you are struggling, we invite you to come in, bring your MRI, we'll do an examination, we'll do an evaluation, and we'll let you know if we can help you. You have a lot of different videos that you could pick. I'm honored that you chose this one, and until we meet again, have a blessed day.